All right, thanks for joining the Let's Get It podcast. I got Drew and Traci Eliszewski in today, and excited to have you guys in.
Yeah, thanks for having us.
I'm proud of you for saying my last name.
Oh, I know you guys. I've known you guys long enough. If I mess it up now, you deserve to be slapped while we're shooting this.
Yeah,
so, it is a hard one to spell. Don't ask me to spell it.
Yeah.
So
I feel like Drew and I say it wrong half the time. There's like a
do
fake
your
F in
best.
there. Yeah.
So Drew's a chiropractor. Tracy's a nurse practitioner who, you worked in the hospital setting for a handful of years and then ended up leaving, and now you're more on the functional side. Is that the best way to call it? Functional medicine?
Cellular, functional,
integrative, regenerative, anti-aging, all of it.
Yeah.
A little bit of all of it. Yeah.
The new stuff and the good stuff.
Yes. 100%.
and the old stuff.
I know.
And the old
I've been, obviously my family's been working with you guys, and I've been working with you guys for a while, and you guys do amazing stuff. So I'm excited to have you guys on the podcast. And what is like, why should more people be seeking this functional aspect of medicine versus more traditional?
Well, I'll start and then I'll let you kind of go. But I think there's a room for both, right? And we complement kind of traditional medicine in a lot of different ways where people, the question I always ask people is like, hey, can high blood pressure kill you? Yeah, absolutely. At that time, medication is definitely needed. Can we work on underlying causes of that blood pressure while you're on medication? Absolutely. And that's kind of like where this medicine really shines, is undercovering or, looking at root causes as far as, symptoms that you're experiencing. And I don't know if you have more to add to that,
Yeah.
but it's like...
Totally. It's just a different perspective, right? I always say we don't have preventative health in our healthcare system, right? It's always
Right.
like...
So you're talking about high blood pressure. Historically, people get on that, and
Yes.
they might be on it for 2 years, 4 years, 20 years.
There's no path to
Yes.
get off.
Totally.
Right? And we're not deficient in blood pressure medication.
Yeah.
Right? We're deficient in, exercise, lifestyle, nutrients, these types of things that can really help our metabolic health and reduce our blood pressure, as an example.
For sure. I always say, I'm an acute care nurse practitioner trained. So, I was in the acute care settings, the ICUs, neurology. We need 100%, we need that type of medicine for those types of, injuries or whatever we need to go to the hospital for, of course. So I always like to clarify that. We're not anti-medicine. We are, trying to get to the root cause and trying to make you live your best life, too. I always say, especially when it comes to some of the stuff we do, you should live well, right? And I have 95-year-olds that literally skip into my office, right? That I've one that jets off to Vegas every 6 weeks, literally. I mean, this is truly, functional longevity medicine, and this is where it's going, and this is why we're so busy at the clinic. More and more people are seeking this out, for sure.
Well, and you could just look at the stats too. Is cardiovascular disease going up or down? Is infertility going up or down? Is cancer rates going up or down? We have all these advancements in traditional.
Going up.
Yeah, absolutely. All of it. Heart disease is still the number one, leading cause of death, right? Well, we haven't really changed that. Mm-hmm. And so having a different perspective, having a different look at, your health, it's only going to serve you, for higher quality years and increasing your longevity and lifespan.
Do you get a lot of people, do you guys believe in the term, you don't know how good you feel until you actually really do feel good?
Oh, yeah.
100%. We used to have that in your clinic wall, actually. We had because we see it all the time, and we have patients that tell us that all the time, too. We just, until we understood, this is why we do a lot of blood work, honestly. Cellular health, cellular medicine is a foundation of what we do at the clinic, for sure, is you have to optimize the cell health for everything else that we do to work, importantly. So sometimes patients just want to jump to right to what their friend did. I'm that's perfect, but we have to do the, the foundational stuff. Longevity medicine is sexy, and it's a word everyone's using, and I would like to say we do it very well, but we do it very well because we start with the foundation.
Right.
Yeah, the basics, it's not you come in and we're just, giving you, a different form of, when you come in with a symptom, here's a medication. Well, here you come in with a symptom, here's a supplement.
Right.
That's just kind of the same. There's no difference in that. Mm-hmm. And so, kind of really understanding how the body works and understanding the basics, right? Food, movement, exercise, hydration, stress management, meditation, all those things is, needs to be in the conversation.
So if someone comes to you guys, what's typically the first, do you guys have a structure like, okay, these are the first steps that we want to dig into to figure out your background, like your history, your, or like where you're currently at? I mean, is there a certain, someone comes to you and they're just like, look, I'm looking to take my health to the next level. And maybe some of those people have a specific thing that's already bothering them or whatever, but is there like a standard protocol you guys kind of go through so that you understand their baseline and and to find a customized plan, or what does that look like for somebody?
For me, there's definitely a system to it, right? And I think this is, a big part of what we do and how we do to get consistent results. And so having at least be good at health history taking and understanding that, but like the questionnaire that we use helps guide us in the direction of where we need to go for this person's health. Because otherwise, some symptoms can look like a GI symptom, some symptoms can look like a cardiovascular symptom, and they can be all over the board. They can come in with, headaches, GI complaints, all these types of things. But until we really understand how all these symptoms can correlate to specific areas of their cells that may be lacking function, then then that allows us to be more customized to this individual and that approach. So I wouldn't say it's necessarily a protocol, because the body is very complex, but we definitely need checks and balances to keep us on track and make sure that we're getting that person's health moving in the right direction from a cellular standpoint.
Mm-hmm. I would say like kind of what he's talking about too is like our initial intake versus like I set my dad up with a new primary care doctor a couple weeks ago, and like they met for the first time. My dad was explaining like his health history to the extent that he could, right? Where our health history questionnaire, a lot of times when I meet with my new patient, I'm like, hey, how'd that go, right? Because most of the time I'm like, I always say like there should be a warning sign or a pop-up sign saying like, hey, sit down, put your feet up. It's going to take like 4 hours to finish,
right.
Because it really is, these health symptoms that you have now may or may not have started 2 years ago, 6 months ago, or 25 years ago, right? So when we're looking about foundational health and cellular health, it's about looking at the blood work now, optimizing that piece, and then also talking about like, okay, when did these symptoms first start? There's a timeline. So I think that health history and that questionnaire he's talking about is really like, it goes deep and it goes back. Yeah. And kind of snowballing off that a little bit is that I was kind of thinking about like the 4 or 5 patients that we like most commonly see as new patients when that like health questionnaire is kind of filled out initially. I would say we have the really, really sick patients that are just like desperate and they're looking for somebody to like listen to them and find like what other doctors or what the 10 other doctors they've been to cannot figure out. And then we have, obviously, we do a lot of hormones at our clinic. Women suffering with perimenopause or even young women with terrible cycles and all that kind of stuff. And then postmenopausal women. And then we have the referred friends who like, hey, my friend had such success here. And then I have the husbands, right? Yeah. Like, and sometimes the husbands come in first, but it's usually like, kind of what you were talking about earlier is like, sometimes they feel really good. And then all of a sudden it's like, my wife told me I should see you. We start looking at functional health and we're like, or their cellular health. And like, dang, I didn't know I could sleep this good. I didn't know I could do that.
What's so you said like 4 or 5 kind of most typical, they're not feeling good, or what is like a typical person that's coming to see you? Is it because they can't sleep at night? Is it because they're just in pain? Is it because they have just got diagnosed with something or they couldn't figure out a diagnosis? What's the...
Well, I think it's going to be different between the two of us because... for me, it's going to be somebody that either has had digestive issues for a long time, can't kind of quite figure it out, have maybe tried these supplements that they saw on Instagram. It worked for a little bit, but then it kind of, the symptoms come back. So we get a lot of gut health.
Saw GI, did colonoscopy. They still can't figure out the reason for it, right? Those gut health patients, for sure.
And then we get a lot of like metabolic blood sugar regulation, weight loss. And then we get the guys like you who come in and they're just like, I'm feeling pretty good already. I just kind of want to optimize myself. I just want to get to the next level.
Yeah. But when I did first come in, we did the gut health checkup. I had a poop and something, whatever. And then you also took some blood or whatever. And, we found out that, obviously I had, what was it? Because it was eggs. For me, I think it was pepper, eggs. Eggs was a big one. Eggs and shrimp and pepper. that were actually like, I started
getting an immune reaction to those foods. And
and I would be like, I remember I was like lethargic. I came to you, I'm like super lethargic. I eat, I don't feel good. My stomach kind of hurts, and it kind of just hit pretty quick. And that's when I came out and we did those tests. And you basically told me, if I remember correctly, I think you told me to just stay off of those get away from them for like 3 to 6 months.
Yep.
Then start introducing them back in and see how you feel.
Yep.
And that was like amazing, because I stopped those. And then I don't remember how long I stopped. I can't remember if it was a few months.
Yeah.
And got back on. It's like every day since. I love eggs because it's a source of protein and whatnot. And so it's like every day since I've been eating eggs, and I haven't had that same issue.
Sure. And I think it's also I think there's something to the quality of it too. Farm fresh eggs, versus that kind of the store, manufacturing eggs. There's a difference there, and you can even see in the yolk, right? Mm-hmm. Like you look at a really good egg, and it's like really dark, almost orange. It's like, okay, there's quality differences, and I think that's being brought to light even more now.
Yeah,
we're talking about Fruit Loops and all these other things, and how they're having they're banned in Europe, but yet we're still consuming them here in America.
I do wish Fruit Loops were good for me. I haven't had them in forever.
Hey, that's an opportunity. That's a business opportunity.
So Tracy, what are you typically seeing then when patients come to you?
Yeah, I see a lot of perimenopause, postmenopause, a lot of weight loss, a lot of seeking answers. I can't figure out I can't figure out what's wrong with me. A lot of fatigue, a lot of joint pain. I do a lot of more regenerative medicine stuff too now. So I do a lot of joint stuff just solely because I have terrible knees myself from being an athlete. So I see a lot of those patients now. And then I also have like my really fit biohackers, longevity people that just like, they heard about something on a podcast and they're like, hey, I know you can help me. So it's kind of a little bit of everything, but I would like to tell patients too, for some of these, we do a lot of autoimmune as well. And that kind of got brought to light a lot more post-COVID too, is just in a lot of post-COVID brain or COVID injury or whatever it is. We see a lot of everything. And I always tell patients, like, I don't know everything. I will definitely get you to somebody who does know everything, knows more than me in that field if I need to. But I would like to say, I'm Drew and I both, and our other providers of the clinic, my nurses are awesome. Like, we have the best staff ever. We will find an answer for you, or find, someone else that's doing it right if we don't know it.
Yeah.
But we see, honestly, I've probably seen everything. And sometimes I know exactly the formula to help them. And then other times I'm like, all right, we're going to start here. I need you to follow up with Dr. Drew. The gut guru is what we call them, or some of these more like,
or maybe it's a referral outside.
Or absolutely, for sure.
We both know our scopes and stick within our scopes. We
totally.
As soon as you try to go outside there and trying to be everything to everyone is really where it becomes dangerous. And so, knowing that is important. And if you don't have the answers, just being honest with them.
Right.
Say, hey, look,
that's the thing, for sure.
There's something off here. I think you need to follow up with a referral for endocrinology or something like that.
Happy to support you along the side, absolutely. But I need you to go see them, and then we'll continue to do what we do.
Yeah,
for sure.
Obviously, something that's picking up steam is peptides, right? So what exactly are peptides?
An amazing therapy that we do a lot of. So I describe them, as like a cell signaling molecule. The body makes about 7,000 naturally occurring peptides every single day. So when we prescribe them, they're either something the body's already making, or maybe isn't making as well as it used to, perhaps, whether that's a virus that got, or biotoxin illness that got in the way of making them, or just age and other factors that contribute to that. But peptides are beautiful. There's a lot of it's a really sexy word right now. So there's a lot of things happening in the different industries, of course. But I like to say, when it comes to peptides and what we do at the clinic, it really is using the peptides that the body's already making already, and then they each have their specific role, right? So I would say on a daily basis, I probably prescribe up to 20, 25 different peptides, depending on what we're trying to do and getting to the patient's goals. Like, what are their health goals and how do we get to them, for sure.
And for the listeners, it is in a sequence of amino acids. A peptide, that's what a peptide is. It's less than a protein, and then it's just more, and it's more than amino acids. So it's this kind of chain of amino acids that can help kind of signal to the cell what it's supposed to be doing if that's kind of been lost over time due to whatever stressors that the body's going through. Mm-hmm. So that maybe give you a little bit more grasp on that. And we see things from, I don't know, everything that you've tried as far as peptides, but, really popular peptides, like for me, for the gut, BPC 157 for inflammation, working on gut repair. We've all heard the term leaky gut or hyperpermeable gut, where things are getting through the gut lining, creating inflammation. That's kind of where those food sensitivities come in too, where if you have some sort of disturbance in that gut, those food sensitivities then can create inflammation because your immune system's reacting to it. You can have joint pain, you can have fatigue, you can have foggy brain, those types of things. That's where BPC is like super, super helpful.
BPC helps with foggy brain?
No, just for the gut, reducing the gut and inflammation.
But so it could indirectly, you're saying?
Oh, for sure.
Got it.
Yeah, absolutely. And that's where we're going back towards the root cause of it, right? If you have foggy brain, what is the contributing factor? Well, you have foggy brain and you also have digestive issues. Well, let's correct the digestive issues because we know we need healthy digestion.
And see if that helps eliminate the foggy brain.
Yeah.
So they say if you have leaky gut, you have leaky brain.
Yeah.
Right? Just inflammation within the body, for sure. There's definitely more specific cognitive peptides for sure that we use a lot. There's a peptide for everything, honestly,
right.
And there just continues to be. This is probably one of the more exhausting things that Drew and I do is just staying up to date on literature and going to the seminars and we've both had an opportunity to present on things too. So it's constantly changing and it's like constantly changing, staying up to date on these things too.
Right.
For sure.
Is there changes coming where they're just more safe, or like they're finding new ways to make it that are more efficient, or?
It's like, I would say it's like I don't know if this is a terrible analogy, but it's like the deep ocean, right? Like there's probably things in there we have no idea that even exist. I would say the same thing with peptides. It's not that they're newer in the body. It's just that we're finding out about them and
right.
like what they can do for the body.
Right.
Some peptides have been around forever, right? Like insulin, right, is a peptide that's been we've established that in the 1920s, 1930s, right? And then semaglutide, GLP-1s, they've been around actually for quite a while. Some of them aren't new, and then there's some that are becoming a little bit more. They're newer and becoming a little bit more accessible for people.
Yeah. I'd say accessibility is one of the biggest things you have to kind of in the peptide world. Because a lot of it's like, if it's working really, really well, a lot of times they try to like pull it a little bit. And then we have to find a way around it a little bit. Just sometimes like manufacturers or different.
Wait, so if it's working, if the peptide is working really well?
Well, look, okay. So this is where we, there's some caution. There's some caution tape around here. But, we've seen things that we were just kind of like, that's kind of interesting why they pulled that peptide off for, not allowing us to prescribe that.
After the results that you've seen, because probably looking pre-blood work, post-blood work, after taking them and stuff like that.
BPC 157 is naturally made in the gut. Our body makes it already.
Yeah.
So,
and there's no toxic, we can't find a level of toxicity for it, so for a safety profile, that's, that's a really good thing. But, you see that work. You see things like thymosin alpha-1 work for things like COVID and some other,
it's kind of like the ivermectin world back in COVID.
Yeah.
And then all of a sudden it gets yanked off and you're like, okay. Well, and then the same thing happened with ivermectin, right?
So then does usually someone else end up making the product like that? And
a lot of times it will come back as a pharmaceutical, honestly.
Got it.
Yeah.
But
so that's like rapidly kind of evolving then and changing.
Always. And that's why it's like, because you'll see like, we were able to get these peptides for so long and then they'll get pulled and then they'll get like new peptides out. And a lot of these peptides have been around. So like when they do that, a lot of providers in the longevity space kind of like start freaking out. And I'm like, there's so many other ones that maybe kind of went to the sideline a little bit because we had those newer ones come out. And so they're available.
Yeah.
That was like the one I got on from you guys.
For sure. There's one that you said might be banned or whatever. I'm like, well, I want to try this one now.
Yeah.
CJ Apomorelin.
Yes.
Yeah.
Yep. Yeah. What did it say?
Share your experience with
again.
that.
CJC
Apomorelin.
Yeah.
CJC Apomorelin. Yeah.
But isn't there a number with it? CJC.
1295.
1295. That's the one I was on. Yeah. Yeah. So I think I cycled that. I took that twice. I was on it for however long you're supposed to be on it. Then I was off for maybe like a month and a half. And I did it again. Yeah. I noticed it in definition. I noticed it in strength. I noticed it in recovery.
Sleep. Did you have any improvement in sleep?
I don't know. That part doesn't really stick out to me. Maybe.
Yeah. Maybe you've been sleeping well before, but
yeah. Well, I think that's part of it. Is there was other things I was doing prior to that helped me with sleep. Then I was also on. There was an amino acid type peptide.
Oh yeah, 5-amino 1-MQ.
Yeah. Yep. And that was the capsule.
Yeah.
Capsule. So I was on that. But yeah, I mean, I've enjoyed, trying different things. I mean, I know this. So I did the InBody when I was at your guys' office yesterday. I did the InBody. So I did the InBody April of, April of 2024. I came in, I was like 19.2% body fat. Didn't do real well early last year. It was just a rough start to the year a little bit. And then the next time I came in was a couple months later. It was like mid or late June. And it went down to like 16.6. And then when I was just in there yesterday, it was 14.2 or something. So I'm like trying to get back down to 10, awesome. Right? Below 10. Yeah. But the thing is too, is like when I was kind of nervous I could do it yesterday. Yeah. Because it was not, I would say my overall, like the last half of 2024 for me with just what I was consuming and eating and a lot less alcohol than the year prior to that, I still didn't think, I can't kind of mind that I had like a neck kind of flare up. So I wasn't able to get as my typical, workouts. I'm kind of back on that track now where I'm working out. So I was kind of worried yesterday. I'm like, I didn't think I was going to see that much improvement, but I mean, I did. So
that's the thing too, is like you also are somebody who's putting in the work, right? Yeah. So I always tell my patients, like, there should be like a banner behind me, like your peptide's going to work just as much as you do. Yeah. Right. So like, that's the biggest thing we see with like the GLP-1s or the weight loss peptides is like, some patients are like, I'm not losing weight. And I'm like, well, it's always successful. I've really not had a patient without, you have these little plateaus from back, but it's just, you have to do the work. You have to be looking at your protein intake. You have to be hitting your step count, resistance training, all that stuff, because everything we do is just going to work better.
Well, then since yesterday morning, I was thinking about like, well, yeah, I did have a lot more Evan Williams eggnog in 2023, late 2023 up here in Wisconsin than I did in 2024. So I'm like, that probably had, but I noticed a huge difference. Like when I don't drink, I noticed a huge difference. For sure. So another thing that I started doing, I think you guys were the ones that, hey, try fasting in the morning. So there's still some mornings where I still eat between, 6 and 7:30 just because how it works out or whatever. But I mean, most days I'm not eating until at least 9:30, 10 o'clock in the morning. And then I can notice a big difference now too, like not eating past 6:30 at the latest. And if I do eat after 6:30, make sure it's more protein than anything. For sure. If I go off of that now, like I realize how horrible you can feel. Yeah. Like, so there's some times where we'll be with friends or whatever, and I just eat like crap until, 11:30 or midnight or whatever. And the next, I like pay for it that night. I don't get as much sleep the next day. And sometimes the day after, like even if I don't drink, but just eat crappy late at night, I'll feel it for 2 days sometimes now.
For sure.
Which is crazy. So like just changing some of those things and increasing water intake, I think is part of the reason where even though I had like, again, a 6 to 8 week streak where my lifting was off a little bit. I think that's why I still am dropping that body fat, just because of some of those other habits that I've been.
For sure.
Well, and you also put on more muscle, right? Like when you're on that CGSA program, you're optimizing your growth hormone, right? Naturally, your own body's production of that growth hormone. And when you do that, it's your ability to recover and train harder the next time, break down that muscle fiber, and then repair it greater than it was before. Over time, you've put on muscle mass, 100%. And that's changed your body composition. And then you made your dietary lifestyle changes. Of course, every once in a while, or during the holidays, you're going to get off a little off
totally
track.
Not compliant the fourth quarter last year, like, and the last half of the third quarter.
Like you've already put in the work prior to that, so it's not going to completely derail you.
Right.
For sure.
Yeah. So like this first quarter this year, and like this year period, I want to be like, okay, how compliant can I be this year? And and even if I can cut out alcohol a little bit more, and like not that I drink that much anyways. I mean, I maybe 2 drinks a month or whatever. But again, how much can I kind of keep limiting and getting rid of all that stuff and just keep adding all the good stuff? And I know my wife wants to, obviously we just had crew and stuff that still breastfeeding and stuff, but she's been talking about it and she wants to get in to see you guys and get on some of the stuff and check it out. And but yeah, and like my parents results are nuts and they rave about what you guys are doing and all that stuff. And
every time they walk in, I'm like, you guys are just like phenomenal people.
They're just like crushing
Superhuman.
it. So,
yeah. I think your dad was like, I'm squatting more than I have ever, and
they're working out.
For sure.
They're watching 100%. What they eat. Yeah. They're going to bed on time. Like this, peptides are part of
Totally.
moving the direction of cellular health, but they're only part of the equation. So when it comes to that, there's other, factors like viruses, bacteria, fungus, toxic burden, nutrient deficiencies, your ability to burn fat at rest and then shift to burning sugar as you start getting more active. All of those are part of the equation.
Yeah. So how do you know if someone's looking to start the functional medicine type journey? I feel like there's are there a lot of scammers out there with this stuff right now? Or like a lot of scam type products? Like you go try to just buy some peptide off Amazon or whatever.
Yes.
And that's why I'm super leery too of like when I was first getting in, that's why I'm like, well, I'm going to go talk to you guys because, I didn't want to just go pick something up off Amazon and have no freaking idea, absolutely no idea what
Well, look, there's money to be made in this industry, right? And so people are catching on to that. And so at every corner, there's somebody doing some sort of peptide, GLP-1. I would caution anybody that would go to a clinic that doesn't do blood work, take a good health history and all these other things and just give you a peptide, because that is a red flag to me.
Or doing check-ins, or repeat blood work.
Not talking about your diet, just saying, okay, go on this GLP-1, you're going to lose about all this weight, but we're not going to talk to you about protein intake. We're not going to talk to you about exercise. Oh, hey, by the way, when you're mobilizing fat, you're also going to be releasing toxins into the bloodstream. Well, so we're not going to talk about detox. Like, this is there's more to the peptides than people realize. And that's where the continuing education and really understanding what you're getting into with who you're getting into with. Right? So
for sure,
there is money. This is a business too. And you got to look for somebody that's actually interested in moving the needle for health for you.
100%.
But there is a lot of confusion about peptides in general. So there's two main categories. You're going to see like the research pharmacy peptides where you can like go online and buy stuff in like powder forms. They ship it to you, and I don't even know what they do, honestly.
You got to reconstitute it.
Yeah, and maybe there's validity to that, but I know some of the bigger peptide gurus, like they back certain pharmacies. But I always encourage even the providers I mentor. I'm like, you should be getting your peptides from a really good, clean compounding pharmacy, right? And that's truly where we get them. All the peptide certifications I've done, they all say like stay away from research. You just don't know what you're getting. Most of them will say like not for human use. Like it's just
stay away from research. Like
research pharmacies or research. It's the stuff you can get off the internet. Right?
So it's basically if it's termed under research, you can just go and buy it.
I see.
Because you're not supposed to use it on yourself. It's supposed to be done for research.
Oh,
right?
Yeah, that's crazy.
It's not for human consumption, quote unquote.
I see. That's interesting.
Yeah. So anything, I have to prescribe a peptide. It has to come from an actual regulated FDA pharmacy, right? And so that's the biggest thing is there's like those misconceptions where like I have patients who are like, I bought this off the internet. I'm like, I love the peptide. I have no idea what's in that.
Yeah, right.
So like, that's one of the things I tell my patients.
It's just like supplements though.
For sure.
For sure. Yeah.
High quality matters. Where you're getting it from matters.
Well, and again, to be able, how often are you guys recommending people come in if they're starting peptides? How often are they coming in to meet or either do a consult with you electronically or come in and meet and do blood work?
Yes, every 3 months for my patients on peptides. As long as they're, now if they're messaging like weekly and or calling us and like having side effects, but that's the biggest thing is like I tell my patients, when you're on a peptide, which is much different than when you heard all of these horror stories with these GLP-1 medications and patients getting super sick. And I'm like, the providers are not dosing you correctly. So if you're dosed correctly and you're feeling well, which you should be, there should be no side effects. And I usually check in about every 3 months, like a quick phone call. Hey, how are things going? Are we getting you towards your goals? Blood work kind of depends on what we're doing. If I'm seeing a patient for weight loss, right, for both of us, we're not just giving you something I know this will work for weight loss, but we have to maintain your muscle at the same time. And why are you not losing weight? Is it because your hormones are off, your thyroid's not balanced, you have such inflammation?
High toxin, mold toxicity, all
like,
these other things, nutrient deficiencies.
Yeah. And I would say that's one of the things that our patients really love about us is like, I'm not just going to write you a script. I would say we're very conservative when it comes to like, specifically when I'm writing a script for anything, I'm like, we're going to start here. We're going to see how you tolerate, because I could line up 10 patients and each one of them is going to respond differently to what I do for them. So
and like most likely, my guess is like someone comes in, they want to lose weight or something. You're able to probably get them started in a direction that doesn't even have to be as aggressive. They're still going to have a tremendous result because it's maybe something they've never done before. They just need to start doing, and they're going to have a tremendous result that way. And then it's like, then some of this other stuff they maybe hit a plateau or, whatever, then it's like, okay, well, it's that next thing. Is it like detox?
Sure.
Is it peptide? Is it
sure.
hormones? Is it?
Here's
Absolutely.
a perfect example. We'll use testosterone therapy, TRT. When somebody comes in and they're
I've like been begging for this thing, and you guys you're not like pushing it. And I'm like, God damn it, I just want to walk out of here.
It's so interesting. Like someone will come in and be like, I want testosterone replacement therapy, and we go in and we test, and they're like maybe on the they're low normal, okay, not optimal by any means, but low normal. But
That's like where I've been at.
Yeah, well, and they're having constipation, let's say. It's like, okay, well, we need you to be having a bowel movement every day because our hormones are detoxified through our liver and excreted, for the most part, in the digestive system. So if your digestive system is backed up and we don't get that, we put you on TRT, or let's say you have, and when we say we, I mean her, or we have somebody that has excessive body fat. Okay, we put you on TRT. What is that going to turn into? It's going to turn into estrogen. Now you're going to have man boobs. Okay, this is a problem, right? So I'm going to set you up for success before I just say, hey, let's talk with Tracy and let's maybe think about TRT. So the way we do things is much more driven for health purposes, not just, oh yeah, you're low motivation, low energy. Can testosterone help with that? Absolutely. It can be fantastic. It can be a complete game changer for guys that are low in testosterone. It can change relationships for women. You have women come in, and you can speak about this, that, all of a sudden they get put on some sort of hormone therapy, maybe a combination of progesterone, estrogen, a little bit of testosterone, and they're like, oh my God, I love my husband.
Yeah.
Again, it's like, it wasn't, I thought there was something wrong with me. Sure. Those are like the best stories because not only did you change your health, but you just changed the relationship.
Yeah.
I mean, I love TRT. We can always talk about that again too. But there are and this is where I think like a well-versed provider, if I put you on TRT at 34 years old, you're probably gonna be on TRT the rest of your life, right? And then your own brain stops making, or your hormones stops communicating, and you stop making it. So don't get me wrong, I definitely have mid-30 guys on TRT that, don't want to expand their families. And we've tried optimizing their cell health, and it's just not improving. If you see an increase in testosterone, I mean, if you think about the biggest reasons that young guys have low testosterone, besides like the environmental stuff that we're finding more and more about toxins, but poor sleep, high stress, insulin resistance, all those things. So that's where that's what both of us will usually start to try, just to kind of, what we're going to do is only going to help your future health and your current health now. And then if it's still not coming up, but I always tell it's work sometimes. This is work. Like when you come in, you do a blood work. Some patients just want a script, and we try to meet them halfway for sure. But we also try to have that conversation. It's like, listen, what we're doing, we're going to prevent your Alzheimer's in 20 years if we don't do this now, or we're going to, optimize your blood sugars, which is going to decrease your cardiovascular risk history or your future histories or future risk. So we do definitely TRT. I think we do it extremely well, but it's because we're more like, I'm just going to write you a script. I'm going to work on this first, and if it's not coming up, yes, absolutely. But there's other ways on TRT too that we can help raise those levels too.
Interesting,
for sure.
So we touched on hormones then a little bit, and that's more of your end of the practice is like the hormones.
Yeah.
And is it typically with women that are coming through, or
Men
and what
and women.
and what are hormones kind of affecting?
Yeah. So I like to say hormones are in pretty much every single cell receptor of your body. And so, they communicate all around. So we don't just have hormones in your ovaries and your testes, right? You have estrogen, progesterone receptors on your breast and your brain. Like there are receptors everywhere. So when
on your heart.
Yeah. And that's the thing, same thing with thyroid. And so when you talk about hormones, there's like main categories that we talk about is your sex hormones, your estrogens, your progesterones, your testosterones, your cortisol, your blood sugar, your insulin, and then your thyroid hormones. I mean, there's a lot of hormones, right? But they're all communicating around the body. So when we look at that, like good amount, that blood work that we call the inflammation panel at our clinic is a panel that Drew and I put together just by mentoring with other physicians and constant learning and just saying like, this is a really good snapshot of what's going on, but how do we optimize that? And it includes all your hormones to see like they're all communicating. So I can't just like start with one and then not expect the thyroid, to be reflective of that or to work better. So it's a little bit of all of that. Both men and women. I mean, yes, low testosterone in guys is typically what they come in for. And so again, there is replacement options, of course, but a lot of times it's the cellular health. And then the women, it's more of like young women. I always say we do hormones wrong from the time we're 10 to 12 years old. And then it goes until, let's make you feel better now. You don't have to have those terrible menopausal, perimenopausal symptoms. And then, hey, also we can decrease your risk of bad things happening in the future by optimizing these things now.
What's usually going wrong starting at 10 and 12 years old?
Oh gosh, this was me in a nutshell.
You start getting
yeah.
your cycles. And then it's like, oh, they got these painful periods, or they got acne and all these other things, or maybe their cycle's a little bit irregular. Here's birth control, right? Birth control synthetic. It has its own issues, right? And I'll let you expand on that, but that's kind of like where it goes. And like for young men, even there now, these kids are getting exposed to toxins at a much earlier age, and we can almost see the change. I remember like when I was in like 8th grade looking at the high schoolers, like they're grown men, like they're full beards and everything like that. I don't know if you remember that, but like you don't really see that much anymore.
Yeah. I just say we do it wrong from the get-go because, most of us, I always talk about like the 3 main sex hormones. Estrogens, main one is called estradiol, progesterone, and testosterone. And for young women, 10 to 12 years old, whenever you get your first cycle, most of us suffer with terrible menstrual cycles, bloating, cramping, acne, PMS, irritability, depression, anxiety, and most of the treatment is birth control to help your symptoms, right? And I always say if birth control is truly for birth control prevention, absolutely. And there's no other means you want to do that. You want to be safe, absolutely. If you don't want a baby, please do that. But if you're doing it for hormones, we're missing the boat big time here because we just give synthetic hormones to women, young girls, which actually stops our body's own production of our natural progesterone, which is our anti-anxiety hormone. So it's super common for me to see an 18-year-old woman, terrible cycles, and on some sort of antidepressant medication.
Yeah, these women come in and they're like, I feel like I'm going, crazy. Like, they have all these anxiety, all this stuff going on, and then you get rid of, you have them. I never tell them, obviously I'm a chiropractor, right? I never tell them to get off their birth control. I say, hey, consult with your primary care, see what they have to say, and ultimately it's your decision. So if you guys decide that you're going to come off, and they do, a lot of times we see that anxiety come down.
For sure. I think a lot of moms, like you start talking about moms and dads, they're like, yeah, that's exactly my daughter. Like, I was put on birth control for acne and terrible cycles, and I still had all of that until my mid-20s, right? Until I started understanding I could balance my own hormones.
They never really take you,
No. I think there's so much more coming out about that now. Like I really feel like the tides are turning. Oh my gosh, absolutely. In terms of just even hormonal support for women, like there's some huge, great physicians that I mentor with and follow. One of my good friends, I would call her now, and she's an integrative OBGYN, and she's like at the forefront of, we have to change this for women. Like we're depleting them of hormones, and when you talk about decreasing the risk of breast cancer and osteoporosis and Alzheimer's and dementia, like there's a lot of hormones involved there, but optimizing those ratios preventatively makes a huge difference.
And to your point, you said you're starting to see this more. Well, I'm starting to see, and I think you probably see it too, it's like...
Yeah, just like different articles, even like in Wall Street Journal or whatever. I mean, there's like mainstream
Lancet,
is starting to like talk about a lot of this stuff.
For sure.
How many times has a young girl now come in and be like, hey, are you currently taking birth control? And they used to be, yes. And now it's like, no, I got off it. I read about, I read the book Beyond the Pill or something that kind of gave them this aha moment.
Yeah.
I think even more that's going to happen with how the election turned out and all that stuff. I think, you saw every single NFL playoff game this last weekend. They showed the national anthem.
We said the same
When was
thing.
the last time? My family was talking about that. I thought of it the first time every single game.
And a prayer.
They prayed before. They had said a prayer before the Texas.
Yeah.
Playoff
awesome.
game.
I didn't. Was that live? And they showed it live
for LA. They did that, which is exciting to see.
Right.
Whether you believe or you don't believe, it's just I think we're getting back to American values, which I feel
so
it.
hopefully that brings a lot of this stuff even more to the
well,
light.
RFK, I think is going to do a good job. I think he's going to be a big part of that. We'll see. You never know until you see, but I have hope.
So a 10 to 12-year-old, if now, like if they have these problems, so instead of jumping on the pill, then what what are they typically doing now? I mean,
We need to figure out why they're making so much estrogen. Like, are they getting it from an environment? I mean, there's so many things that lead. I mean,
Plastics.
laundry detergents.
so is that also like a
plastics.
blood test at that age even, or what, or what's,
Well, there's multiple ways, and I'll let her just
Yeah.
go off that of how you test. You can do, for young women, sometimes it's nice to do a urine test, a dry hormone urine test. A Dutch test is what it's called, and it can kind of look at, their metabolites and how they're breaking, how they're detoxifying, and maybe there's an issue with the liver. Again, maybe there's an issue with they're not having a bowel movement, and they're just recirculating all this estrogen, and so it comes down to, looking at the whole picture.
Right.
Maybe they are just like consuming a lot of toxic, or putting toxic stuff on their skin, makeup, shampoos, deodorants, all these types of things. We need to look at that and evaluate that because there's these things called xenoestrogens where they kind of mimic estrogen, and they occupy those estrogen receptors even though they're not actually estrogen.
So it's all about the ratio. Like if you can really, support their estrogen detoxification. So you can look at blood. It depends on the provider you're talking to. You can look at blood. You can look at urine. You can look at saliva. Like there's lots of ways to test it. But it really, truly, I mean, I look at a lot of labs every single day. And if you're truly optimizing that ratio between the two, like you should be in a much better spot than, let's say somebody comes in with a really high estrogen load, not enough progesterone, and their sex hormone binding globulin, or some of these detox pathway labs are like really, really not good, then it makes a huge difference.
so there could be 10 to 12-year-old girls right now that get put on the pill because they're feeling a certain way, and that certain way they could be feeling could be because of the makeup they're wearing.
I would say that's part of the
picture.
equation.
It could
right?
be a part, yeah.
But I would also say
it's
like
not probably the sole reason,
Right.
but it is probably could be a contributor.
Gotcha.
Yeah, I mean, we do a lot of, I always say like when we first started kind of functional longevity medicine, both of us were like, we're not going to do Lyme, we're not going to do mold. And
Not going to do what?
Lyme, like
Lyme.
looking like further, right?
Got
Looking in, and I say further, but
Just
like looking at the further root cause, because Lyme can be very complicated. Mold is something that no one talks about in traditional medicine, right? Like no one really thinks it's a real thing until it like shows up in your lungs and you're like, well, why do you have all that in your lungs, right? But both of these two things, like when you're truly talking about functional medicine, digging down deep, why I'm bringing this up now is because you can have two people, right? You can have two young girls that wear the same exact terrible makeup or the same exact terrible diet and the same exact terrible detergents, whatever it is, or use plastic, whatever it is. And because of their genetic makeups, because of their genomes, one may not have any issues detoxing regardless, and one may be holding on to every single part of that toxic load. So when we see mold patients, we do a lot of that testing to say, okay, or we can do that testing to say, okay, you have this genetic makeup. Two people can be in the same exact moldy house. One of the person's going to be super symptomatic, cold, sinus, fatigue, joint pain, whatever it may be. And the other person is like, I have no symptoms. It can't be our house because, I'm fine and he's not. So there's genes that they're definitely contributing to that toxic load if you're detoxing.
What is Lyme?
Like Lyme disease.
Oh, okay.
Like
Got it.
tick bites.
Yeah.
They're just, both of these are super
I didn't know if it was the
prevalent.
same thing or not.
Yeah. Both
And
of
then
these are
literally
super prevalent.
mold issues just because you're overexposed to mold that might be in an apartment or a house or whatever.
Totally.
And you've been
School
picking
systems
up.
are like
Work.
the number one place.
Oh
you
shit!
find
I didn't
mold.
even think about that.
Yeah, schools are like a lot of times these really
Right.
old
1930s,
symptom-
1950s,
yeah.
1970s.
Well, it's just like I had this patient, and she was working at a school, and she started having all these issues. We started working on detoxification, and then summer came, and I'm like, okay, this is going to be a good opportunity to kind of just like see how you do out of that environment. And her labs looked phenomenal after that. Her fatigue was much less, just because of the environment she was in. And like just to be clear with the Lyme, though, it's like it's still one of those very complex diseases, and
specialist by any means.
if it's at a certain point, that is also a referral to a Lyme.
Sure.
Someone who just does Lyme.
Yeah.
just because it's complicated. But these are the things that, in traditional medicine, we don't do a great job of understanding that Lyme and chronic Lyme is a real thing, right? You could be bit by a tick 5 years ago and your body's still kind of fighting those infections, immune system's suppressed. So these are like those really kind of sick patients are like, listen, I've been to every single doctor. I cannot get help. And these are those, really complex, comprehensive testing that we're doing that is looking more at like, okay, in traditional medicine, we have usually looking at 1 or 2 strains of Lyme bacteria, where like the test that we do is like, I don't know,
Yeah, it looks like
12
all
pages
the
long.
different types of co-infections,
Yeah.
viral infections, those types of things, where it's just like you're kind of getting a better understanding of what their immune system is reacting to. And I will say, like, from a chronic disease standpoint, I always tell my patients it's like a bucket, right? And in that bucket, we have nutrient deficiencies, subclinical infections, so infections that aren't, acute, creating fever, creating, those kind of more acute responses that we get to an infection, but are still low grade, there. And then also toxic load. And when you start experiencing symptoms, that's when that bucket's kind of overflowing, right? You might have an infection with a nutrient deficiency and exposed to, something at a high degree from a toxic standpoint, whether it's from work, environment, water, your moldy house, those types of things. So that's important for people to understand, is that it's usually a combination of these things.
Makes sense.
There's a lot of levels to this stuff.
Yeah, for sure. So with my body fat percentage going down, I've never done a detox with you guys or whatever. What does a detox look like, and how often is it good to do it? Is it something like once a quarter, once a year? What?
Look, it's 2024. We're not getting
not
any less
anymore.
toxic. Or 2025.
14 days behind.
Yeah, 2025. I always say 2024 because that, I'm in the last year talking to patients, right? But 2025, our toxic load isn't getting any less, right?
Air you breathe outside.
So
is usually
I usually tell patients, like, this is kind of like mandatory at this point.
Yeah,
And so some patients, depending on their toxic load, we might go every 4 to 6 weeks.
How do you know their toxic load?
So we can do testing, right? And so we can look at, there's antibody testing for toxins, and then there's also a urine test that we do.
Did I do one of those or not?
I don't
Back in the day, 4 or 5 years ago?
I don't
No.
think so.
Okay.
No.
I don't think
But
I
we
did
should
either,
do it.
but
Yeah.
Yeah, it's just a nice little adjunct to kind of just, see what you're getting exposed to and what you're excreting, right?
For sure. Talking about like heavy metals. We're talking about
Mold. We're talking
plastics.
yeah.
Things that we all
Glyphosate.
We've tried to stop like all plastics. Like, so, well, the one
Here we are.
But right, this is the once a week that I. So okay, but with plastics though, is there different types of plastics or not?
Well, there's just different chemicals in these plastics, right? They remove BPA, but what do they substitute it with,
Well,
right?
right.
And so, they test for different, ingredients that they use.
What
for
about
plastics.
the big ass reusable water jugs
Which one are you referring to? Are you talking about like?
the 5
to
gallons.
get water? Yes, instead of drinking water.
So we use glass. We get a spring water delivered in glass container. It's it's a really big pain in the butt.
Yeah, for sure, to not break those.
Not even break those, but you should see the archaic strategy
Really,
we use. I mean, it's like me just
curse under my
picking up
breath
this
at
fire
Yeah.
and just dumping it in the
Yeah.
pitcher, right? And this is what we do. It works for us,
Right.
Yeah.
But like when we first got, we were like, we want spring water. So we went and got this thing, and they bring the bubbler there, and we hooked it up, and I took one sip of it. I'm like, what's the point of drinking spring water when this tastes like plastic? I'm like, this doesn't even make sense. Let's spend the money on the glass. Even though that we have well water, we're just like, we're not trusting it. We don't have a reverse osmosis system. So we're like, we're going to spend the money on the glass, which Aaron Rodgers just had that in his Netflix, same exact one that we have.
Yeah.
So I don't know, maybe we're doing something right.
Interesting. Okay.
I think if you have the choice, though, spring water is what you always want to lean to versus like distilled, or you just get more of the
Reverse osmosis is good too. I mean, it just takes all the bad stuff out of it. But just using minerals
replete with minerals,
to replace the stuff that you're not getting in your water.
for sure.
Yeah. All right. So back to what is the detox? What does that entail? What does that look like?
So everybody
in your guys' world.
Every time
Drew's
we
the
get somebody
detox
coming,
guy.
I love this
Always a
topic
joke at our
because
clinic.
it's just such an important topic, and it can have such a big impact. I've seen people's testosterone levels raise after a detox significantly.
Sure.
So there's that. But from a detox standpoint, there's a lot of things that have to happen. Number one, you have to mobilize fat. So you have to lose weight during a detox. Otherwise, you're not mobilizing the toxins, because toxins are stored in fat. And so when we start thinking about it from this perspective, okay, well, we know where toxins are stored. They're stored in our fat. We need that. They're excreted in a couple of ways, a little bit through our breath, but through our skin, through sweat, urine, and then through our stool. So we need to be having a bowel movement. We need to be having proper hydration, and then we need to support the liver, right? And everybody's like, well, I'm taking this miltexol, I'm taking this turmeric, I'm doing all that. Those are great supplements, and they will help your liver, but they're not going to support detoxification. And actually, sometimes they can inhibit it. So, and it's the same thing. Like I did this juice detox. Well, did you know some of these fruits that you're putting in a juice can actually slow down your detoxification? Well, we don't want to be doing that if we're mobilizing toxins. So we need to mobilize toxins. We need to support the liver. We need to make sure we're excreting, and we need to make sure we're sweating. So in the detoxification program that I learned under a very smart doctor, Dr. Brian Walsh, he's a naturopath.
Is it what path?
Naturopath.
Naturopath?
Yeah.
Okay.
And so, he goes on to describe, like, we need to be exercising, we need to be losing weight, and we need to be sweating daily. And then there's certain things that we need to do that once those toxins are released into the digestive tract, that we need to bind onto them so they're not reabsorbed, because bile can be reabsorbed, I think it's like 16 times, maybe even a little more, back into the circulation. So you could be mobilizing toxins, excreting in the digestive tract, and then reabsorbing them.
Right.
So the binding process is super, super important. And how we do it is through a special type of diet, certain supplements that upregulate liver enzymes, and then we use things like activated charcoal, bentonite clay. Depending on their medications, we make sure that we're spacing that out. But we use those things to bind onto toxins so that they can eliminate them. And then your sauna, I know you have a sauna, right? Sauna is super, super important and non-negotiable during a detox.
For sure.
Like, you really, okay, I shouldn't say non-negotiable, but we need to be sweating.
Yeah.
So 30 minutes of exercise followed by 30 minutes of sauna.
Yeah.
Absolutely must. So when you're having somebody saying, oh, I did this detox, and they're like, all I did was take this shake or do these juices, it's like, well, that's more of like think about it I always use this analogy, a janitor going in and cleaning the hallways of a school, but not really getting into the classrooms, right? So it may have helped you. You may even be a little bit healthier from it, but you didn't do a detox.
Right.
When he goes through detox, the whole clinic knows.
Yeah. Well, I'm not saying it's easy.
How long is it?
I'm not saying it's easy.
How long is it?
So usually I do 4 to 5 days of a detox, and then I'll space it out, and I'm up for my next detox here because it's been about 6 weeks. So I'll be doing the next detox here fairly soon.
So you do 4 or 5 days. That's not that bad. I one time I tried the fast thing you have bone broth, you have chicken broth.
Yeah.
And I did the Dana White White thing that I saw. I felt good after doing that.
You will. So in a detox,
great.
you can feel sluggish.
I think that was like.
Yeah.
And then you can have more energy.
I ended up fasting for like 72 hours, I think, or something like that. And but with chicken broth, right? Yeah, chicken broth.
Yeah.
So it's 4 to 5 days, and then there's products that come with that too.
Yeah, depending on if the person's on medications or these types of things we have to be mindful of. But there are certain supplements that can speed up the liver, and we can use those supplements, and then the binders. Okay, and then there's a supplement called modified citrus pectin, which is shown to have a lot of benefits as regard from the immune system, but it can also bind on heavy metals.
Yeah.
So it's a specific diet, a calorie deficit. You have to be sweating, and then these certain supplements that help support the liver. You can do 5 days. You can do 10. You can do 10 days. It's just we always start with 5.
Sometimes I have people start with 3. I'm just like, I'm gonna meet you where you're at because I know you're gonna be healthier from it.
Yeah, for sure. Just get them started.
And really, again, you have all these people in the longevity medicine space. They do longevity medicine, and it's like this is crucial. If we're just talking about preventative health and longevity medicine, getting you back to prevention of, we know there's a lot of heavy metals in the brain for people with Parkinson's, right? So a good detox once a year can help start eliminating that things and not allow that toxic load to happen. So really kind of bigger picture, which a lot of patients, they come back and they're like, this sucks. Like, why? It doesn't sound terrible. It does. It can be
challenging for some people depending on the time of year.
It's only 3 to 5 days.
Totally.
Yes, but when you're like just eating this,
just pick like a Monday through Wednesday when you're working anyways, and just grind it out and.
Yeah, I mean,
you should.
You just got to commit.
Yeah,
you just got to commit to it and just be like, you know what, I'm doing it, and that's just the way.
What are you eating? Are you eating nothing?
It's soup. It's a certain type of soup that was created by, again, Dr. Brian Walsh, that it has a lot of cruciferous or sulfur-containing foods that really push detoxification pathways. So, and it gives you the nutrients, but puts you in a caloric deficit so that you're forced to lose weight.
And you probably do feel tired. You hit day 3 and you feel 4. You feel that's how it was when I fasted those 72 hours. I hit
the first couple of days. Yeah,
for
well,
sure.
it was for me the first morning obviously super easy. Then that first night was like okay, this kind of sucks now because I want dinner. Then the next morning I was actually okay. And then the next night I was sucked. Then the next morning and the rest of it just like brutal.
Like
but just remember like how you felt afterwards. You weren't succumbed by food cravings or that food noise. Yeah. Because once your body gets more efficient at burning fat, and also you cut out all that like really hyper palatable foods, all of a sudden you're like, because I've gone through it too, where I'm like, oh man, I am for some reason craving sweets or whatever, and I'm like, oh. I'm becoming my insulin sensitivity is less, and my metabolic flexibility is not there right now. So then you go and you do something like a 16-hour fast, and then you change it up to high protein, high fat intake, and boom, you're back.
Yeah, you're gonna do it.
Yeah, I'll do it. Start on either a Sunday morning or Monday morning, and just roll out, and then be done by Wednesday, Thursday, something like that. Done by Friday morning, whatever.
Yeah. The girls
will
do
it.
I should do it though, because so what do you mean like when you're, because you said before too, my body fat's going down. That means I probably have toxins at that point, right? You probably have toxins going through your body. What toxin? I mean, because you're breaking down fat. So what toxins does that give you? Like
we don't. So you're talking about the test, because I couldn't tell you exactly what toxins that you're having, but there's all sorts of toxins, heavy metals, plastics, glyphosate,
and all of that by losing fat gets that circulating around your body and gets
because that's where it's stored. And when you break open those fat cells, you're breaking open the fat because now your body's using that fat for energy. And when you do that, that lipolysis that happens, you're breaking open that fat cell, and with that comes along the toxins.
Yeah, that makes sense. Yeah.
Now, somebody who has a lot more weight to lose is probably going to be a lot more toxic as they start to lose weight.
For sure. No, that makes sense.
But this is why we constantly do blood work. We're constantly look at liver markers. We're constantly looking to see like what that looks like, and then supporting it through some of the other stuff we do.
Yeah. You guys, but still the gallery test still a thing? You guys still been doing and stuff?
A lot of it.
Yeah, I haven't done that one in 2 years. I think 2 years I've been do that.
For sure.
You guys had someone that had a flag and was able to catch something or not yet?
Honestly,
the gallery is what's a gallery for people that listen?
It's a blood test actually that will screen for a specific. It'll flag it from certain cell lines if there's anything suspicious looking for cancer. It's by a company called the Grail is the gallery test, and so it's definitely become more popular. I think there's been podcasts and books on it and stuff like that. I still recommend it to like anybody that wants to kind of like, I did it a couple of years ago, just for like peace of mind, all that kind of stuff. And then anybody over 55, there's a lot of validation and research to support, like we can catch things much sooner, right? There was a doctor, I always give the example, the doctor in Milwaukee who caught a stage 1 pancreatic cancer with the gallery test, which is never usually found until stage 4. So there's
which is a very aggressive cancer.
There's another one, there was another test that some of my integrative oncologist patients are doing. Like there's so much out there, and there just continues to be so much cool things.
One of the other tests that I think is going to become very popular is the RGCC test, which this is the test that my dad did to uncover some early prostate cancer, right? So when this kind of happened and we started seeing some of these levels rise in his blood work, we found the RGCC test, and you get the blood work.
So in his regular blood work, you start to see some changes that really didn't make sense to you, or just kind of made you, question it.
Why isn't this getting better? This is staying elevated, that kind of thing. PSA, prostate-specific antigen, looks at inflammation in the prostate. Well, this is like one of the kind of like another aha moment where you get this blood test done, and you have to send it to Greece, right? Well, why don't we have that test, right? Why don't we have that, accessibility to something like that?
Doesn't make money.
So then this test comes back and it tells us, hey, you have these circulating tumor markers. They're still very low, but it is a problem. And so then we get his blood, we send it back to Greece, and then they can test what types of chemotherapy, what types of natural things will have an impact on his tumor cells. Now think about that. Why are we doing that?
Right. It's crazy.
It's phenomenal.
So what's that test called? The
RGCC.
RGCC. And
The test is called OncoTrace, but the RGCC.
But that's specifically for a specific cancer?
No, it kind of screens them.
Yeah.
So it's almost like a gallery, different than a gallery?
Yeah.
Got it. Okay.
Gallery is going to look at different cell lines from different areas in the body. The RGCC is really, most of the time we're doing it for patients with known something.
Or high suspicion.
Or high suspicion for something, and then sending it over there. But I suppose, I don't know if I've seen the research on like just a normal young guy doing an RGCC test versus the gallery, like what actual cell types differentiate on there, I guess.
Makes sense. It's interesting.
But I would definitely go to that for sure.
Yeah, I think Europe has got some really kind of cool things as it comes to medicine. Even some of the peptide stuff. We look back to Russia, that's kind of like where a lot of those things, it's funny with the peptides, bodybuilders are always the first adapters to it, right? They're always the ones that are like, how can I enhance my, my physique? How can I enhance my performance? And they're like the early adapters. And then it comes to like the mainstream medical or, to like integrative functional medicine.
Yeah. Well, and even like some of the NFL guys that invest with us and stuff, I've talked to them about, and there's certain stuff that they really can't take or, whatever, but like a lot of them try to go as far as they can before, and like they're into this. And so it's just kind of cool that it's, I don't know, that means that it's like how long until a lot of this stuff is a lot more mainstream. I mean, is it 3 years? Is it 5 years? Is it 10 years?
Gosh,
I mean,
in the
hopefully
past 2 years, it's become way more.
For sure.
Than, I talk to it's rare, but I do get a few patients who are like, we start talking about peptides and they're like, I had one patient a couple of months ago. She's like, do you know anything about peptides? I was like, oh boy, do I ever.
Yeah.
But she had been getting it offline somewhere across the states randomly. And I was like, we can hone this in a lot better for you. For sure.
Sweet. Yeah. But hopefully that's the case. I mean, you look at, there's these economists that I follow, and one of the 5 reasons they think there's a huge depression coming in the 2030s is because of healthcare costs.
Oh gosh.
Right? I mean, that's one of the 5 like things that they're just like, they don't see any way around this. And I'm like, man, like there are so, like, if you're just proactive in what you're doing
totally
versus, and that's exactly what you guys do. And that's a cool thing is, especially for me, because I've always been like with my football background, entrepreneurial type background, business background, I'm always trying to be proactive in my business, always trying to be proactive as an athlete.
Totally.
And it's the same, to me, it's just like a no brainer.
Yeah.
Why would more people not be proactive with their health?
Yeah.
To have the energy, to feel good, to be able to be stronger, to live longer. Why would you not?
Yeah.
So it's
remember I think it was your dad that came in like the first time I saw him, and he was like, listen, I have somebody take care of my finances. I have somebody do this. I have someone do this. I have no one that's like looking at my health from a different perspective.
For sure. Yeah.
And I'll never
well, and it's like, I know you guys are aware too, because I think I shared this with you guys about having a hard time getting life insurance when I try to get, because there was like some kidney flag or something that, and it's like the regular medical health world kept like sending me here and sending me there and say, I'd call and follow up. Well, you got to ask this guy that I sent you to. I'm like, well, he just sent me back to you because like nobody freaking knew anything.
Yeah.
And so like working with you guys and working and then I was able to change my numbers. And I got the life insurance policy maybe like 6 months after. Yeah. So it's like, and so again, that to me, that's made me like a huge believer in what, and then I see through my parents and I see, some other people I know that go to you guys and what's going on with them. And I'm like, to me, it's like a no brainer that people need to do something different with their health and be, again, more proactive and try to stop just with the Band-Aid stuff. And hopefully COVID is going to open, just RFK and all this stuff is going to open to more people's eyes to not necessarily just believe every single thing that they hear. Again, not to trash on doctors or whatever, but just not to necessarily just take it. And because I'm just skeptical of everything.
Yeah.
Every single stat, everything, like that you guys tell me, that the doctors tell me that, but I'm at least open to all of it.
For sure.
Right? I'm open to all of it. And then but then again, you start to actually see where people are, like, results speak, right?
Yeah.
And you actually start to see what's going on with people's blood work, and you see this stuff. It's like a no brainer that why would I not do more
for sure
functional health versus just relying on
for sure.
Totally. And I think, what you described there, and I tell my patients the same thing. I'm like, okay, just, you need to question everything. Question what I'm telling you. Question what your doctor's telling you. It's not a bad thing to question it. That's a good thing.
People need to. It was like they were shamed to do that during COVID.
For sure.
Yeah.
And that's a whole story. But
the silver lining of COVID too was that you had people that were like, I got to stay healthy, right? In order to fight this virus, I have to be healthy. So
because metabolic health was one of the big contributing factors in underlying conditions, right?
100%. Metabolic
health might be the key to pretty much every chronic disease, including neurodegenerative disease, including cancers. There's a person out there in Canada that has the metabolic approach to cancer and does very well, right? So, metabolism is a big deal.
Yep.
For sure.
And making sure it's, working efficiently and healthy. But, another thing that I will say is, you maybe had the experience before is you go to a doctor and they tell you, this is what we're going to do, that, just like your experience, right? What I always say to my patients is like, look, we're on a team. I want you to feel good about what we're doing. And if you have input, I want to hear it. I might have recommendations and I'm here to guide you, on this path, but we need to have a good dialogue and we need to be working together because I need you invested in your own health. It can't just be me. Right. And I think that really jives with people. They're like, I'm so glad to hear that. Like, I want some input on my health, as you should.
Yeah.
Yeah. Totally.
But I think people are getting more open to filling the bucket and getting to a root cause and filling a bucket up that they're missing versus just covering up with a Band-Aid or just, taking something that cuts off that pain receptor or, whatever.
Yes.
Like, let's,
for sure.
And I think people are so much more open to that post-COVID. And
there is a lot of, you had a question earlier, like there's a lot more functional medicine clinics popping up for sure, which I think is phenomenal. But Drew and I are always like, good luck. I hope them the best. But this stuff it takes
hard.
It
for
takes
sure.
so long to get good at it.
Well, that's just like anyone that's going to go invest with someone who does real estate.
Totally.
Right? You guys invested in a project. Like,
totally.
It's like who you invest with because of what they know and how they've trained and how they like. It makes a big, big difference. For
sure.
For sure. As far as how consistently they can have success and whatnot. Right? And so,
and like just like you talk about us. Well, when I have somebody I'm talking in financial, I talk about you, right? It's like, look, I had really good experience here.
Yeah,
we made money with Justin. I think you need to take a look at it.
But like, there's a lot of people that do real estate, know, and then I'll tell them what I do. Like, I do real estate a lot different than you do, know, and like I invest in, and so, and again, there's multiple ways to win in real estate, but there's also people that are in real estate that can really mess, and we've seen it a lot over the last 2 or 3 years that they really, really messed up and lost a lot of people's money.
For sure.
I think it's about intention, right? I think it's about what is your intent? Our intent is always about the patient and making sure that we have their best interest at all the time, just like you are with your investors, right?
Yeah, but I think there's also people that have that intent. But then they also they just don't know what they don't know and don't.
For sure.
You guys, like with your education and like again, like you guys are going to all these conferences and and you guys are always learning, just like I was always learning real estate. And I think there's some people that have that intention but maybe don't necessarily have the work ethic behind it too to figure out all the right answers, and they're not trying to harm necessarily. I think there's people that harm kind of intentionally, just trying to like again make a buck or whatever. But I think there's also people that harm unintentionally, just
sure,
totally,
absolutely.
And
I think my intention also drives my motivation to seek that education too, because I'm so invested at getting patients results that I'm willing to spend whatever I need to do to make sure that we're doing that. From an education standpoint, if there's something out there that I don't know, then I want to know more about it.
100%,
and at least be able to know when to refer, or also if it's within my scope to be able to implement.
Yeah, that makes a lot of sense.
It helps being able to bounce things back off each other too.
We have a great crew where we work at, very intelligent people, and not just at our clinic, but just nationwide, where we collaborate. If we don't know something and we're just like, hey, how can we help this patient? We do the background work that nobody else sees, and we go and talk, hey, can you take a look at this patient's labs? Give me some ideas of what you're thinking on this. And if it confirms what I'm thinking, then we go with that plan. If he or she, whoever we talk to, says something different, then we reevaluate. And she has different experiences being in the hospital system right? And I have that kind of different, I've always been that kind of like integrative, holistic, functional medicine mind, driven mind. But together they work really, really well.
Right.
For sure.
That's awesome. Yeah. Anything else you guys want to share?
I don't think so. I mean, I always love, I feel like your family, like we text all the time, like we're just like on that level. But no, I think it's been a great, working with you guys has been awesome on the health aspects, the
real
investment
estate
aspects for sure. So we appreciate you bringing us on for sure.
No, you bet.
Thank you for having us on. It was a fun time, good conversation.
Appreciate it. Thanks guys. And thanks for listening, everybody.